dive into a recent case study that uncovers an unusual complication associated with monkeypox infection, myocarditis. This surprising connection came to light when a 31-year-old male patient developed acute myocarditis, an inflammation of the heart muscle, about a week after displaying symptoms of monkeypox. This situation is as intriguing as it is rare. Monkeypox, a viral infection similar to smallpox, usually presents with fever, headache, muscle aches, and a distinctive rash. Myocarditis, on the other hand, is commonly associated with various viruses, but not frequently with monkeypox. It's like finding a needle in a haystack. Out of 528 monkeypox patients studied, only 2 developed myocarditis, both of whom recovered within a week. This particular patient, the 31-year-old man, spent a week in the hospital, his heart battling inflammation while his body fought off the monkeypox infection. The question that springs to mind is, who is at risk? Currently, it's unclear. Monkeypox doesn't discriminate, and neither, it seems, does myocarditis. Chest pain or related symptoms should prompt those with monkeypox to seek medical care. Those with a history of heart disease, severe immunosuppression, or HIV infection should consult a medical provider regarding care. Myocarditis usually improves on its own or with medication, but severe cases may require further treatments or interventions. The frequency and duration of this cardiac involvement in monkeypox cases are currently unknown. This new information shouldn't change how we perceive or treat monkeypox, but it's a valuable piece of the puzzle for the medical community to be aware of. While myocarditis is a known complication associated with viruses, it is uncommon in monkeypox cases, making this an intriguing subject of study. Now, let's delve into what myocarditis is and why it's significant. Myocarditis at its core is an inflammation of the heart muscle or myocardium. This inflammation can lead to a variety of issues, including abnormal heart rhythms, heart failure, and even sudden death in severe cases. The most common causes of myocarditis are viral infections, but it can also be caused by a reaction to drugs, exposure to certain toxins, or part of an autoimmune response. The symptoms of myocarditis can vary greatly, ranging from mild to severe. Some may experience no symptoms at all, while others may experience chest pain, fatigue, shortness of breath, or even a rapid or irregular heartbeat. In extreme cases, myocarditis can cause a sudden loss of consciousness or cardiac arrest. Now, the risks posed by myocarditis are significant. If left untreated, it can lead to serious complications, including dilated cardiomyopathy, a condition where the heart becomes enlarged and can't pump blood effectively. In some cases, myocarditis can also cause heart valve problems, leading to a lifelong need for medical management. Thankfully, myocarditis often improves on its own, especially when it's caused by a viral infection. Rest and medication can help manage the symptoms and prevent complications. However, in severe cases, further treatments or interventions may be needed. This can range from medications to manage symptoms and prevent further heart damage, to devices to correct heart rhythm problems, or even a heart transplant in the most severe cases. It's important to note, though, that myocarditis is not a condition to be taken lightly. It's vital to seek medical attention if you experience symptoms, especially if you have a known infection like monkeypox. Early diagnosis and treatment can significantly improve the prognosis and reduce the risk of long-term complications. The link between monkeypox and myocarditis is still a grey area in the medical field, with the frequency and duration of cardiac involvement in monkeypox cases currently unknown. Let's examine the statistics behind monkeypox and myocarditis. A recent study threw light on a fascinating facet of this subject. Among 528 individuals diagnosed with monkeypox, myocarditis, the inflammation of the heart muscle, was reported in only 2 cases. This might seem insignificant at first glance, but it's a crucial piece of the puzzle. These 2 cases of myocarditis occurred within a week of the patients experiencing monkeypox symptoms. This timing suggests a potential link between the virus and the onset of myocarditis. The good news is both cases resolved within a week. This rapid recovery indicates that while myocarditis may be a complication of monkeypox, it's typically not a long-term one. However, it's important to note that the frequency and duration of cardiac involvement in monkeypox cases are currently unknown. While this might seem a bit unsettling, it underscores the fact that every patient's experience with monkeypox can be unique. The study also raises the question, who is at risk of developing myocarditis after a monkeypox diagnosis? The answer, unfortunately, is still unclear. This ambiguity emphasizes the importance of ongoing research to better understand the relationship between monkeypox and myocarditis. In light of this information, it's crucial that individuals with monkeypox who experience chest pain or related symptoms seek immediate medical care. Those with a history of heart disease, severe immunosuppression, or HIV infection should consult a medical provider regarding care. While these statistics highlight the rarity of myocarditis in monkeypox cases, they also emphasize the importance of understanding this potential complication. The medical community needs to remain vigilant about the possible complications of monkeypox, including myocarditis, to ensure the best possible care for patients. These figures underline the rarity of myocarditis in monkeypox cases, yet emphasize the importance of understanding this potential complication. Now consider who might be at risk of developing myocarditis after a monkeypox diagnosis. As it stands, the risk factors are somewhat shrouded in mystery. This is not a clear-cut case of A leads to B. Rather, it's a complex interplay of multiple factors that are not entirely understood at this time. Let's delve a little deeper. Myocarditis, an inflammation of the heart muscle, is a known complication associated with various viruses. In the case of monkeypox, it's relatively rare, but it does occur. Now, who might be at greater risk? The answer is not straightforward. However, individuals with a history of heart disease, severe immunosuppression, or HIV infection are advised to consult with a healthcare provider if they contract monkeypox. Why? Because these conditions could potentially heighten the risk of complications, such as myocarditis. But it's important to remember that anyone experiencing chest pain or related symptoms, regardless of their health history, should seek immediate medical care. It's always better to err on the side of caution, especially when dealing with a disease as unpredictable as monkeypox. We find ourselves at a crossroads where we know just enough to recognize the potential danger, but not enough to fully understand it. This lack of clarity regarding risk factors underscores the need for further research. To round things off, let's address a few commonly asked questions about monkeypox and myocarditis. First, how is monkeypox transmitted? Monkeypox is primarily transmitted to people from animals, particularly through direct contact with the blood, bodily fluids, or cutaneous or mucosal lesions of infected animals. Human-to-human transmission can also occur, usually through large respiratory droplets during close physical contact. Next, what are the symptoms of myocarditis? Myocarditis, which is an inflammation of the heart muscle, can cause symptoms such as chest pain or discomfort, fatigue, shortness of breath, or rapid or irregular heartbeats. In some cases, myocarditis can lead to serious complications like heart failure, heart attack, or stroke. So, who is most at risk? While it's unclear who is specifically at risk of developing myocarditis after a monkeypox diagnosis, those with a history of heart disease, severe immunosuppression, or HIV infection should take extra caution and consult with a medical provider regarding their care. Finally, what are the treatment options for myocarditis? Treatment for myocarditis usually aims to manage symptoms, prevent complications, and eliminate the underlying cause. This may include medications, lifestyle changes, or in severe cases, procedures or surgery. Remember, this new information doesn't change the perception or treatment of monkeypox, but it is crucial for the medical community to be aware of potential complications.